This meeting is being
I can sing over the music. All right, welcome. So wonderful to have you all here today. Thank you for joining us. I'm Alina Dorian, the Associate Dean for Public Health Practice, as well as Equity, Diversity, and Inclusion at the UCLA Fielding School of Public Health. And I've also been a proud K-12 school principal for 10 years. I'm excited to be here for our Principal Practices for Safe Schools webinar. We have an incredible afternoon planned focusing on group-based contact tracing and testing in our K-12 setting and the successes and difficulties that we've all faced in operationalizing it. We're lucky to have with us our insightful public health expert, as well as incredible colleagues working tirelessly to keep our schools a vibrant and safe place for learning. We were fortunate to have a wonderful panel last week as well, and the recorded webinar is up on the California Safe Schools for All website under the Virtual Training Academy header. We truly hope that the information and dialogue today and last week can better inform, empower, and create confidence in the decisions we all need to make to keep our schools safe. I'll try to keep a bit of time at the end for some of your questions. Use the Q&A button, please, to enter your questions, but also to jot down further ideas to help facilitate programming, webinars, information as we move through this academic year. We also welcome your comments and insights in that Q&A button. Please put in what you've been doing, how you've been operationalizing, especially group tracing strategies, and what that looks like adapted to your local circumstances, resources, and realities. Please also allow me one more moment to thank our collaborating partners for today, the UCLA School of Education and Information Studies, the California Safe Schools for All team, and our California Connected Consortium, consisting of the California Department of Public Health and our academic partner, UC San Francisco. I also want to recognize and celebrate Black history. Although it's highlighted in the month of February, we continue to honor and celebrate it every day of the year. So help me welcome our incredible panelists. We're honored to have with us Dr. Sohil Sud. Dr. Sud leads the Safe Schools for All team at the California Department of Public Health, where he works closely with state and local health and education agencies to develop and implement policies to keep our kids safely in school during the COVID-19 pandemic. Prior to this position, Dr. Sud served as Chief Clinical Lead of the Information and Guidance Branch within San Francisco Department of Public Health's COVID Command Center. He's an Associate Clinical Professor of Pediatrics in the Division of Pediatric Hospital Medicine at the University of California, San Francisco, and he cares for newborns and hospitalized children at a number of Bay Area hospitals. We're also very pleased to have with us Ms. Andrea Foster. Ms. Foster is the Coordinator of Health Services and Home Hospital Instruction for Santa Ana Unified School District and has been a school nurse for 23 years. She received her bachelor's in nursing and master's in psychiatric nursing from Southern Illinois University and is a passionate learner. She worked in women and infant services for Barnes Hospital, Washington University School of Medicine for 3 years, which included labor and delivery, postpartum, NICU, infant assessment, and women's oncology. In 1999, she received the opportunity to move into school health and has found it extremely rewarding. We're very lucky to have her. Ms. Foster received a National Board Certification of School Nurses in 2021. Next, I'm pleased, Mr. Eric Vetere. Mr. Vetere is the District Safety and Emergency Manager for San Bernardino City Unified School District. He has served in public safety for the San Bernardino City USD for 23 years. He was born and raised in San Bernardino and began participating in public safety at the age of 14 as an explorer with the San Bernardino City Fire Department. He's also an EMT, and as District Safety and Emergency Manager, he oversees emergency preparedness, mitigation, response, operations, and recovery. He has led the district through many crises, including leading the COVID-19 incident management team. He's committed to bridging gaps and building relationships with other agencies to keep schools and communities safe. And lastly, we're happy to have back with us, and now an alumni of the Principal Practices Series, Ms. Hannah Mestel. Ms. Mestel is the Pandemic Services Coordinator for Pleasanton Unified School District. Prior to joining, Ms. Mestel spent nearly 17 years at Google working in product management, HR, strategy, and communications. She holds an MBA from Harvard Business School and a BA in communications and human-computer interaction from Stanford University. She has 2 children, a high school freshman and a 5th grader, a husband who loves word games, and 2 fluffy Labradoodles, Hazel and Leo. And when not at work, you can find her performing on stage in community musical theater productions around the Bay Area. So, once again, thank you all for being here, especially this amazing and talented panel, and to all of you for coming today. And now it is my honor to turn over the virtual podium to Dr. Sohil Sud.
Great. Thank you so much, Dr. Dorian. It's really a pleasure and an honor to be with all of you today. Hope everyone's doing okay. I want to start by echoing some of the gratitude Dr. Dorian shared and really just thank all of you, each and every one of you, for everything you've done to prioritize and provide safe in-person instruction to all of California's children, particularly on behalf of my 1st grader who spent all of last year in virtual kindergarten. Thank you. Let me spend a few moments to start off the presentation just by putting some context in terms of how we're doing in the state of California overall. So this is a slide that I pulled from the New York Times not too long ago that shows basically the entire history of the pandemic in terms of cases, tests, hospitalizations, and deaths in California. And you can see over here, this was the peak that we occurred last winter. This is the Delta surge at the beginning of this school year, and this is the Omicron wave. Very, very steep climb up, but fortunate to report now we are climbing down just as rapidly. So good news on that front. We do know that after cases, hospitalizations lag by a week or so, and then deaths lag beyond that. And so relatedly, we are seeing hospitalizations come down, but not quite nearly at the same proportional level as we're seeing cases already drop to. And deaths are still climbing. So it's yet unknown what the total of the Omicron wave will have been in California, but we'll find out more shortly. What we do know, though, is overall in the state, so far, 80,000 lives have been lost to this pandemic. And roughly 16,000, if not more, children have lost a primary caregiver. They've been orphaned in one form or another as a result of this. So significant toll to families and communities throughout the state. And now let me dive in a little bit more into schools. So how are we doing in terms of schools? We've had two objectives really since the start of the efforts here at the Safe Schools for All team with the California Department of Public Health. And it's essentially to keep kids in school and out of hospitals. And with regard to keeping kids in schools, this is a data tracker from a website called Burbio that tracks the number of disruptions to schools throughout the country. And each dot essentially represents a disruption, so a temporary school closure that's COVID-19 related. And this chart here is just since the beginning of January. And you can see overall, there certainly have been some temporary school closures in California. But compared to particularly parts of the South and parts of the Northeast and the Chicago region, we've done fairly well. In fact, we educate about 12% of our nation's school children, and the number of closures we've had since the beginning of the school year is far less than 1%. Far from perfect, but significant nonetheless, and coming really at the work of all of you. So again, thank you for everything you've done to keep the schools open. And to keep the kids and staff safe. And with regard to how we're doing in terms of keeping kids, out of hospitals and healthy, this is the numbers that we're tracking with regard to children in the hospital with COVID compared to populous states that are somewhat analogous to California as any one state can be. And the California line is the thicker blue line here. And you can see relative to other large states, we have done a good job at keeping pediatric hospitalizations lower. This is during the Delta wave at the beginning of the school year. We see places like Texas and Florida really impacted. And then places in the Northeast in New York and Pennsylvania hit a bit harder over the winter time here. And that has an impact well beyond COVID. We know in Texas over the late summer period, there was no pediatric ICU beds available for a 19-county area for close to a 4-week period. So that has impacts on any child needing intensive level care throughout that region. So again, gratitude for everything that's being done. But let's move forward a little bit and see, where things are going. Now that cases are on the decline, we can adjust our mitigation accordingly. And so as time marches forward, we get smarter and we get more precise with our response. And I think we're steadily marching to a place where we can really focus on prevention, and specifically thinking more about vaccination and improving indoor air quality. Essentially is ensuring that our bodies and the spaces we occupy recognize, contain, and remove the threat of COVID-19 before we even really have to be conscious about it. But just to touch on masking for a bit, since that's clearly a hot topic, earlier this week, on Monday, Secretary of Health and Human Services, Dr. Mark Ghaly, announced the following, which is essentially effective yesterday, effective February 16th. The state has moved from a requirement for all to wear a mask indoors and to strongly recommending it for vaccinated individuals, while still requiring it for unvaccinated individuals, along with maintaining ongoing requirements in various sectors, including schools. What was also announced at that point in time is in now, I think it's about 6 school days from now, the state will be more formally revisiting school masking. And between now and then, we continue to track all of the metrics, all of the numbers that I just showed. And if those continue to trend in a positive direction, then we hope to announce more specific definitions around a transition away from a requirement for school-based masking for everyone in that space. So we want to remain vigilant. We want to ensure that every decision we make is science-based and protects the health and well-being of students and staff. But the science is showing us that optimistically we can have a good spring in store for us. But today we're really here to focus on quarantine and to think a little bit more about what we do with children who are exposed to COVID-19. And traditionally, and one disclaimer I'll give around that is any statements that I'm making really reflect California Department of Public Health policy, but they must be filtered through the lens of what's happening locally, as local public health officials do have the right to make additive guidance and in some cases additive requirements to protect the safety of their communities. And relatedly, California Occupational Health and Safety Administration, Cal OSHA, also has some emergency temporary standards in place that are applicable to workplaces and employees. So with that as a disclaimer, let me start by just outlining the definitions of the terms. Isolation is when we talk about someone infected, someone who has COVID-19 in this case. Quarantine refers to when we're talking about someone exposed to the virus, and what we do to restrict the movement of those who are exposed in case they become infected. And currently, the policies that are endorsed by the CDC and used throughout much of the world and throughout much of the United States focus on contact tracing down to the level of the individual, isolating the individual who has COVID-19, so having them essentially away from that space, and then figuring out who else was around that area and suggesting that some who are beyond 6 feet don't need to quarantine and those within 6 feet fall into various categories, which in schools in California, we've divided into these categories, saying that some who are vaccinated don't need to quarantine, others who have engaged in an interaction in which parties were not wearing masks should participate in the standard quarantine, and others in between may stay in school in a modified quarantine. So that has been one of the approaches that the state has really endorsed since the beginning of the year. What we're here to discuss today is a little bit about an approach that we endorsed and put forth at the beginning of this school semester, so in early January of this year, which is what we've called the group tracing approach. And so this is now focusing still on isolating anybody who's positive with COVID-19, but everyone else in that space can be notified now, and notified with the following messages. So number one, you've been exposed in a school setting, but stay in school, wear your mask as directed, and watch for symptoms, and get tested. Those are the four main messages that we want to impart with this type of guidance, along with just a general message that if you haven't been vaccinated yet, consider getting vaccinated to protect yourself and protect your community too. What's the evidence behind this approach? So why do we feel comfortable recommending a group-based notification model and contact tracing that is essentially a model that doesn't have any child outside of school just because of exposure alone? Number one is that there's good research supporting this type of process. So there's studies out of California, out of Illinois, out of Massachusetts that show in a school-based setting, if someone has COVID-19 and interacts with somebody else with COVID-19, someone else in a school setting, the chances that they're going to actually become infected are exceedingly low. In one study, it was on the order of essentially 1 to 1.5 individuals out of 100, and another study was about 3 out of 100. So well over 97% of the time, that close contact is not going to become infected. And further, there have been some studies that have shown even if that second person becomes infected, chances are very low that it's going to cause a super spreading event or a cluster of any sort. Even more to that point, in two studies, one in Massachusetts and one in California, there were 0 cases of a secondary contact causing a tertiary contact to become positive. Essentially, the chain would break after the second one, most often really after the first one, but almost all the time after the second one. So good data to show that there's very low rates of in-school transmission. Secondly, overall, as folks have moved to this model, we have not seen prolongation of cases in youth. Cases, as I mentioned, are dropping overall as they are within each age bracket. So under 18-year-olds in orange here, cases are dropping. And even if you subdivide that under 18 group to different age categories, all of them are coming down. So even as individuals are remaining in school, despite being exposed, cases are fortunately coming down. And then finally, we recognize that the individual contact tracing model, understanding who was within 6 feet for 15 minutes, is really operationally burdensome. It was challenging during the Delta surge, which again is this level of cases, and in many cases, downright impossible with the Omicron surge. And so really, if you can't do contact tracing fast, you can't do contact tracing well. And with this volume of cases, it became exceedingly challenging to do contact tracing fast. So for all of these reasons, nearly a month ago now, we pivoted to provide this group-based tracing as an option for individuals. And I'll just note we're not alone in doing so. We were at the vanguards of making these recommendations, but since then, Massachusetts, Vermont, Kentucky have recommended similar policies, as has the broader Council of State and Territorial Epidemiologists, who have recommended since that public health agencies transition away from universal case investigation and contact tracing for individual cases of COVID-19. And so because of those, so as a summary, this is the prior model of contact tracing down to the level of the individual. And this is the model of contact tracing down to the level of the group. Again, identifying groups of individuals who shared the same airspace for 15 minutes and telling them all stay in school and get tested. The points that I'll note with that, though, is that while the prior model involved an intensive amount of contact tracing, this current model does entail a fair degree of testing. And we are working on narrowing guidance regarding who needs to be tested, as opposed to a blanket recommendation that all get tested. And look forward to more conversations and discussions about those pieces. So that's the context. We have a lot of information on our website, and perhaps later in the presentation, happy to go back and walk through our website, but encourage all to visit schools.covid19.ca.gov. You'll find the details of the guidance here. That comparison chart I just showed is also up, as well as sample notification letters, which to the extent it's helpful, you can plug and play in your communities and insert your school's name, insert the right contact information. But those concepts of saying stay in school, wear your mask, get tested, all that information is pre-built into many different letters, as well as some supports around clickable decision trees and a PDF version of it to help folks navigate and walk through this guidance. We're also trying our best to have individuals learn from one another, as is the intent of this forum too. And we have a newsletter that we try to send out that allows folks to see what other school districts are doing, what other counties of Office of Education are doing, what other public health departments are doing, including links to their actual guidance to see how it's being implemented at the local level. And for anybody who has specific questions, we want to hear from you. We have what's called a technical assistance portal, which is again right on our main page, schools.covid19.ca.gov, where you can click on Start Your Request and speak to someone from this very team, the Safe Schools for All team, and our partners at UCLA and UCSF to help navigate any nuances that may arise from the guidance. But with that, I will stop sharing and move on to really the stars of the show, who are here to share their experiences in adopting this type of guidance. Thank you again.
Great. Thank you so much, Dr. Sud, for that detailed presentation. But also, I really want to thank you for your expertise and grace through this whole process and just helping us kind of navigate through our challenges. It's been extremely valuable. And I'd like to now, just as Dr. Sud said, turn to our on-the-ground school heroes. I'm pleased to invite Ms. Andrea Foster. Ms. Foster.
Thank you, Dr. Dorian. So I'm with Santa Ana Unified School District in Orange County. Next slide. And I'm happy to be here with you today. I just want to give you some basics about our demographics in Santa Ana. So we have approximately 40,000 students, 7,000 staff members. We have 53 schools. We were founded in 1988. We're the second largest school in Orange County and the 11th largest school in the state of California. We have 7 high schools, 8 intermediate schools, and 36 elementary schools. We're primarily a Hispanic community with approximately 45% being English learners and a high percentage being low socioeconomic status. Next slide, please. And I want to preface this slide with the fact that in the very beginning, we started testing very much like LA County did. So we have testing in place where both staff and students are tested on a weekly basis. So this might look a little different for us than it may for some of the other school districts. So as we came back from winter break and we were in the midst of this massive surge, we quickly realized that our resources were going to be tapped. And so when the California Department of Public Health offered this lifeline, we grabbed it and ran as quickly as we could. We put it in a systematic format so that it was pretty easy to follow, both for our nursing staff as well as our administrative staff. So obviously the first step is identifying who the positive individual is. And then once we do that, we're looking for those potential exposures. So when you do individualized contact tracing, it's more about looking to see, again, who's within the 6 feet for greater than 15 minutes. So with the group tracing, we're looking at class schedules and extracurricular activities to determine who those individuals are. We then have a prepared letter that just has to be edited. That letter then goes out to the class and the individuals who are part of the extracurriculars, as well as we send a letter out to our entire school population. We've done that since the beginning, and as we started to move into group tracing, our families indicated that they would still like to know when there was a positive individual on campus. So we do the dual notification. When we do the notification, we do it multimodal. So we want to make sure that we reach everybody in our community. So we utilize Parent Square, robocalls, paper copies, and our Google Learns email accounts. In addition to that, we put a little bit of a spin on it. So for example, in our special ed classes and with those athletic events where the masking is inconsistent, we're doing the individualized contact tracing and letters go out to the families based upon whether it's a low risk or a high risk for those particular families. The benefit for group tracing for us has been that we can quickly identify those individuals that are potential exposures, and we can swiftly notify families so they can start to monitor for symptoms. Probably our biggest challenge has been to help both our staff and our families understand the difference between individual and group tracing, and why at this point in the pandemic that the group tracing is more appropriate and gives the best benefit. Next slide, please. So lessons learned. So I would say the biggest lesson that I have learned is making sure that our policies and protocols are in writing and that everybody has access to them. That's the biggest issue. If your protocols aren't in writing and people don't understand what the practices are, then they get very frustrated. And so what we have done is centralized location for these policies and protocols in a Google Drive that all of our stakeholders have access to. So whenever they have questions, they have easy access to those protocols and practices. Communication, I'm going to talk a little bit about on the next slide, but it is vital to make sure that you're communicating with all your stakeholders. And preparing your staff. When we came back in January, there were a lot of changes in rapid succession. And so I would say the biggest issue is trying to stay 2 steps ahead if you can, and then making sure your staff is aware of what those changes are and be prepared for the questions that are going to come. Next slide. Communication. So I put this graphic here because it's really interesting how you can start out with the word peas, and by the time you get to the end, it's fleas. And so my recommendation, or what I have found to be vital, is communicating often and early, and making sure, again, that you're using that multimodal communication practice, and communicating with all your stakeholders, making sure that your Board of Education, your leadership teams, your administrators, your teachers, your staff, your families, and your community leaders are aware of what your policies and protocols are. Again, not knowing is what causes the misinformation as well as the frustration. And thank you very much, and I will turn it over to Dr. Dorian.
Thank you so much for all of that information. And I think, again, coming back, it's always, we hear the same thing, consistency and communication, but also this idea of change and being able to, as educators, we use the C's usually in a different way, but I think these are really important to think about, especially with communication, as you were mentioning, the game of telephone. You start somewhere and it ends somewhere. So thank you so much, Ms. Foster, for all of that information. I am now pleased to invite Mr. Eric Vetere. Mr. Vetere.
Thanks, Dr. Dorian and Ms. Foster, you nailed it on the head. The please to fleas is exactly what we've all faced throughout the course of this pandemic. Thank you for having us on behalf of the San Bernardino City Unified School District. It's an honor and a pleasure to share our little piece of the story as we move through this. So next slide, please. So I'm going to share you some information on the district, our tracing strategies, the benefits, and the challenges and lessons that we've learned thus far, knowing that we're right in the middle of doing it. Next slide, please. So a little bit about our school district. So we're located in San Bernardino County, Southern California. We're the 7th largest school district in the state. We have about 57,000 students and about 9,000 staff. Throughout the course of the pandemic and even early on, we had high community spread, high community case rates. We were one of the first school districts to shut down, and we were the first school district in the state to announce very early on that we would not be coming back and reopening, just so that we could give our families and our employees, some peace of mind, and so that they could start making some decisions in their lives. And as we started to look at the current school year we are in, we realized that managing COVID was not something we were accustomed to, nor was it something that we had the staff to do it with. So we know that all of our educators are very busy already. They're trying to do their primary job, and adding this on, asking administrators to do it, asking school nurses to do it, was going to be overwhelming, frankly, for our system. So very early on, we contracted this out, and as we know, no one was ever doing this work before they started doing this work. And so we vetted many vendors, and we wound up with a group called AM. And so they've been boots on the ground, managing COVID within our school district since we returned this school year. Next slide, please. So just a little bit about our mitigation and response strategies, and this is data we've pulled from the first several months of school. So as you can see, being able to participate in the CDPH testing program, we have an entire operations section that is doing nothing besides ordering test kits and making sure that we do not run out and that we're able to test as needed. So we've tested over 34,000 students over the course of this. Just in the height of this winter surge, we did over 6,000 tests. We had everything from drive-throughs to the at-home test kits, and just a ton of work. So if you look, down at the bottom with the communication, the partnership, and the education, we know the education is key. Just the level of work that our system alone has seen with the, 40,000 emails and 40,000 phone calls, really solidified our need to bring in the extra support so that our teachers could focus on what they could in the classrooms. Our parents could get the peace of mind. Our administrators at the school levels could focus on, their job of coaching up and building their educational staff, and really trying to keep COVID management out of their way as much as possible. So we placed a liaison at every school. They have rapid test kits, PCR test kits. We have case investigators and tracers, and all the events. So we've been fortunate to not have any school outbreaks, and have kept, over 1,000 kids as we started this in school. So it's been a really good but tiring effort, as I'm sure many of you can attest to. Next slide, please. So as the rules changed on us, and we moved into group tracing, we decided, as we looked at our demographics, at our approaches, is that we needed to do a hybrid. We needed to have the ability to do individual tracing for the areas, such as school buses, our sports teams, cafeterias, after-school programs, And then using really the group tracing method for our classrooms, the shared indoor airspace, and primarily because of the availability of test kits. So we know, as Dr. Sud said earlier, just the amount of test kits that would be needed in the event that we had multiple positive cases at a school site. If you're looking at secondary education where a student travels between 6 periods, you could be burning, the burn rate of test kits could be in the thousands a day. And so we were concerned that if we went full approach with group tracing, that we would quickly burn through test kits. And so we've set with kind of a hybrid approach. Our elementary schools are benefiting most from the group tracing because they're kind of contained and stay in the same shared airspace. And our secondary schools and the other locations, we're doing the hybrid where we're doing individual and group tracing. So it was very hard decisions to make. We had a lot of logistical meetings to figure out how we were going to do that. Next slide, please. So the benefits to our hybrid strategy involved the continued use of the contact tracing process, and then also allowed the group tracing, gave us more flexibility to meet the needs of our school sites and really each situation. So we all know there's not a one size fits all. There's not one answer for everything we're doing, and we're all getting the questions, right? What about this? What is this scenario? And so we really wanted to use these as options for us to meet the best needs of the school, to keep as many kids as we can in class. And so that's allowed us to do that. And then just supporting our students for staying in school. Like I said, that's our job. Our job's education. And we can't do that if we're sending a lot of kids home to quarantine and sending staff members home to quarantine. And so how can we use all the tools that CDPH and San Bernardino County have given us to do our best to keep our students in school and educated, which we know is exactly where they need to be. Next slide, please. And then just challenges that we faced and lessons that we're still learning. Active parent consent. So making sure that all of our parents who originally said it was okay for their children to be tested in the individual testing model were also okay, and that we obtained new permission for the group testing. We know we didn't want to have to call parents every time their child was involved in group testing or tracing. And so we wanted to make sure that we had good consent, that we did good notification to them, letting them know that they had the 3 to 5 days if they wanted to opt out. But really just the communication piece, like you heard earlier, because the lack of communication will lead to hallucinations, will lead to confusion, and then you end up managing that instead of COVID. So just communicating with our families, and then really the inconsistent COVID management statewide in the school system. So we know that most of the things that have come down to schools have been recommendations outside of Cal OSHA. And so one of the things that we've really faced, even within our own county, is the inconsistencies in how COVID is managed at different schools. And so you have families that will say, well, in this school district, they're not doing this, or in this school district, they're doing this, why aren't you? And so really that's been our biggest challenge is really a need for us to standardize how we're managing COVID so that it's one message in all the locations. And I believe that finishes up my presentation. Thank you.
Thank you so much, Mr. Vetere. Honestly, the most important piece always for me, being that administrator, is I love hearing, in some ways, just the realities and all the decisions you needed to make, and then remake, because that's sort of what we're all dealing with. And I think, again, so much of this platform is this idea that we're all going through this, and just to sort of hear both the commonalities and then the ideas or the hacks, right? And sort of thinking about what that looks like for our district. So thank you so much. All right, I would thank all of the panelists for their insight, their wisdom, of course, sharing all these things that are keeping you up at night. Can I please ask you all to turn on your cameras and join me? We're also super lucky to have back with us Ms. Hannah Mestel, one of our incredible panelists from last week. We're going to go into a bit of Q&A, but I want to also note, I believe Dr. Sud pasted in some of the links to the research that he cited. So keep an eye out on that. And if you guys don't see it, please let us know. We'll repaste it in for all of you. But I am going to ask Hannah if she can start. Hannah, I believe you have a question for Dr. Sud.
I do. Thanks, Dr. Dorian. Dr. said, regarding group tracing, can you talk a little bit more about testing, whether it's required or recommended? And then while you're on the subject of testing, can you speak a little bit about the reliability of rapid antigen testing with respect to Omicron and other new variants that may emerge and how it might impact our testing strategies?
Sure, happy to do so. And thanks for joining back into the panel too. Since the start of the school year, essentially all of the state's guidance around isolation and quarantine for K-12 students have been recommendations. And that includes like the prior guidance around contact tracing and this new group tracing model. We understand that there needs to be some flexibility and some nuance, and also an understanding of the resources necessary really to implement these types of practices. And so it's a recommendation, and there can be some local variations in terms of how it's implemented. And just as Eric was mentioning around the hybrid approach of using one approach in one context and a different approach in another context, all of that we welcome, and we think it's as Alina was just saying, it's a nice hack of trying to figure out what works best for your community, your culture, and your operations. All of that I think is really important going forward. And with it being a recommendation, I suppose I'd also just add that it's okay to put more of the onus on families as we go through this, as opposed to having schools track every data point in terms of did they get tested, what was their result for every single point. I think we ask so much of schools, just to the points that have already been raised, to enforce masking, to perform testing, to promote vaccination, and to teach. And so to put a requirement on testing, also means the need to track all of that. And that's part of the reason it's a recommendation, a real consideration, but a recommendation, particularly when the data corroborates that in-school transmission is so exceedingly low. That was a lot. Your other question was around rapid antigen testing. Yes, with Omicron and how it works. Really well, I would say. So we have to remain humble and continue to assess the efficacy of all our diagnostic instruments against any changes we see. So it may not be the same with any subsequent variant, but with Omicron, there have been studies done, and the data is now very clear that rapid antigen testing is a very terrific tool. It's never going to be as sensitive as PCR testing, but nor does it necessarily need to be. So when it's collected and processed appropriately, it's very good at picking up a case of someone who's infectious. And that's what we care about, right? And by collected appropriately, I mean swabbing as directed in your nose. There's some talk and stuff on the internet about swabbing your throat or using it in different ways too. But there's actually been studies done by our academic partners in California that have shown quite definitively swabbing your nose as intended is more accurate, not even equivalent, but way better than swabbing your throat, the other areas. So just recommend using it as directed.
That's amazing. Thank you so much, Dr. Sud. I also want to just kind of echo that one big word that you use, teach. So we do expect a lot out of our schools and our administrators, and we're very grateful, but we do realize, that's one of the reasons for this panel is to really think about what does that mean in your learning institutions as you're operationalizing all this. And coming back off of something that Dr. Sud said, so I'm going to ask our incredible education partners a little bit about resources, right? So what is your recommendation when we're working in places that have limited staffing, both for testing, but also some of the other implementation of the guidance as we're moving forward? What does that look like? And do you have any tips or things that you can think about to pass on to other school administrators that are on this panel and will be watching the recorded video? What to do to really meaningfully prioritize testing? And Hannah, can I start with you first, and then I'll jump to Andrea and then Eric.
Sure, Dr. Dorian. So we are a smaller district than what was described by Ms. Foster and Mr. Vetere, in terms of we're about 14,000 students and 2,000 staff. So we don't have the same large scale weekly testing operation that they do. Although interestingly, our weekly testing numbers often approach what San Bernardino was describing, which kind of startled me. I'm wondering how we managed to do that. But that being said, we've really prioritized our response testing to focus on, first and foremost, symptomatic people, regardless of exposures. And then our second priority is those who have household exposures, regardless of vaccination status. So we're finding that where most of the exposure that's happening that's actually converting to new positive cases is within households rather than the school community. So anytime we have a positive case in the house, we're asking everyone in that household to be tested and really focusing on catching those cases before those students come back to school, regardless of vaccination status. Our third priority tier is our unvaccinated students and staff without symptoms. So those exposures who have not become symptomatic, we're still asking them to test at 5 days. And in many cases, we're requiring it of them. And then our fourth tier of priority is those prior positives who want to test to shorten isolation, because as I've heard a lot from my fellow panelists today, our goal is to get those students back in school where they can continue to learn in person. So testing to shorten isolation has been the next priority for us. I will say that the data has been less than exciting on that. We haven't seen many people testing out of isolation before day 8 or 9 on most cases. And I've learned a lot about the timeline under Omicron being so different, especially among fully vaccinated and boosted individuals. So they're getting symptoms earlier. So day 0 is earlier, and therefore their testing timeline becomes very different. So we're not seeing people test out much earlier than that 10-day mark. And then finally, our last testing priority is vaccinated school exposures without symptoms. So that's how we're prioritizing our resources. I will close with saying we do weekly surveillance for our higher risk groups, regardless of exposure. So our wind instrument musicians and our athletes who are playing high risk indoor sports with lots of contact, like basketball players, we want to make sure that we're screening them on a weekly basis. So it's not just like nobody gets tested without any sort of surveillance behind it. It's just that we've really prioritized which groups they happen to test weekly.
I would say for Santa Ana Unified School District, because we have testing in place and we are testing close to 40,000 people on a weekly basis, that it has been very beneficial for us. So we don't have to go back and ask the people to test at day 5 or send test kits home. So having a partner is incredibly beneficial. In addition to that, we have access to those records once the lab has run them. And so we at any point in time can review those records and know when a student can come back to school. And I would have to say that we probably get kids back on day 6, probably more often than them waiting until day 10 to come back. And so again, we're in the business of education. And so keeping those kids on campus as much as possible is always our goal. Kind of in addition to that, we don't have to worry as much about our athletic events, so they can go, our field trips can go without issues, without concerns. Our vendors are tested, our teachers that are doing internship hours are tested. So, we feel like for us as a large district that has been very beneficial for us. I would say for smaller districts, if you have not looked into CDPH's testing task force, we looked at them initially and they have a lot of great resources. And so if you're a smaller district and just don't feel like having a partner is an option for you, I definitely would utilize CDPH as an option.
Yeah, and you know what? Hannah and Andrea covered most of my answers as well. I think us having the partner vendor on scene, on site with us to help us manage this has kept the test kits rolling in. I think where we've currently found ourselves is the increased demand for at-home testing. And so many of our families and our staff are looking more to us now saying, well, why can't I do this at home? Or when are more test kits coming? But as far as us being able to test within our system and the priorities for it, it really matches what everybody else is doing. We have our sports teams and our music teams that are getting tested weekly. We have special events at their school sites. And with our on-site liaisons, so having a specific COVID liaison at every school site with the availability of both rapid and PCR kits, they're able to really handle the schools at a micro level. And so we're not having to set up such massive testing events, but we also do symptomatic drive-through testing events for our employees. So we don't want them returning to school or work if they're symptomatic, but we also know there's a shortage of test kits. And so we want to get them tested and back to work as soon as we can as well. So we do 3 drive-through testing events a week. And then we do also return to work walk-up testing events twice a week. So testing hasn't been an issue for us. We hope it does not become that way, but I think just the transition that we're all experiencing, that we're all going to see at some point where you can get the test kits to your house, they're readily available, is the wave of the next, the future of this and what we're looking forward to.
That's a lot of really amazing information. And it's great to sort of see the differences that we have to deal with. You know, a lot of times the larger counties are well-resourced, but you also have a lot of more people, your populations, you know, and sort of thinking about all of those other things. So I'm going to turn to Andrea. I believe, Andrea, you have a question for Dr. Sutton. Andrea, you're muted. Sorry.
All right. Dr. Sutton, could you please discuss the testing and the 90-day exemption for previously diagnosed or infected individuals? Are previously COVID-19 positive students who are 90 days exempt from testing and also exempt from group-based contact tracing?
Mm-hmm. Yeah, good question. And let me just start by saying, I recognize in writing, the guidance essentially recommends that everyone exposed be tested. And I can tell you, we're moving away from that. So the guidance was developed at a time when the CDC basically said something similar. But at this time, you know, it's reasonable to exempt those who are recently infected from receiving testing, so long as they remain asymptomatic. So and certainly from PCR testing, and that's stated in the guidance. And part of that is because we know if you've been recently positive with a PCR test, that test can stay persistently positive and persistently positive for quite some time. And so really the utility of you know, taking a test after you're positive with a PCR test that much later is not going to really tell you anything. And with an antigen test, as you know, we're going through this program, we're recognizing as well that it can stay positive for a little bit longer too. It doesn't necessarily mean you're always infectious. There have been studies to see whether you can culture virus of someone who's, you know, out further on. But the fact that it still stays positive means that it's not really helpful and can be tricky to interpret. That's not, again, to say that vaccinated individuals are less protected in any way. It's just that the testing in someone who's recently infected is a little bit more challenging to discern. So so it's reasonable to walk away from recommending testing for those who are recently infected and newly exposed within a 90-day period.
Thank you so much. It's very nuanced, just like you talked. And so I think this is, you know, why we keep coming back to these webinars, and all of us having the office hours, having the Safe Schools for All hub with, you know, frequently asked questions and sort of running through some of these things. But again, we need to then be able to operationalize it within our districts, within our schools, and sort of make that a reality. So Hannah, I'm going to turn to you and ask you a question, if you're okay with that. We continuously hear that some of the biggest challenges really around group contact tracing is in this masked and unmasked spaces and sort of what that looks like. We hear people say, you know, younger children usually can't identify sort of who they sat near, ate near, et cetera. What does that look like, you know, for you in your district, really just thinking about operationalizing it and making group tracing actually work for you in the schools?
Yeah, thanks for that question, Dr. Dorian. It is a really interesting exercise in taking this guidance and figuring out how to operationalize it in a way that works in our unique setting, but also to hear the similarities that were shared, especially what San Bernardino said about it being a hybrid approach that ultimately ended up working well for them. I will tell you that's what we've landed on, and it's working quite well for the last month or so that we've been doing it here in Pleasanton. So we do our elementary schools, we do group-based contact tracing with the group exposure notification where we have a really defined classroom. And we do actually notify for individual contact tracing everything that happens without masks. So with one exception, our special day classes where the majority of students are unmasked, they all get group contact exposure as well. They don't get individual tracing, even if they are unmasked at the time of exposure. That being said, there are some really interesting things that we've learned and had to make exceptions to. One was we had about 2,000 students notified through group exposures in the first week that we did this because of the peak of the surge that we were in at that point. And so even individual classroom notifications at the secondary level became infeasible and kind of just like noise for the parents and families who were receiving them. So for us, best practice ended up turning into more of saying, hey, middle school and high school students, guess what? You're exposed all the time right now. Treat yourself accordingly. Monitor carefully for symptoms. Get tested if you have symptoms. Get tested if you're worried. Get tested if you're curious. We're going to be here for you to test, but consider yourself exposed. And then we went to just individual tracing for unmasked individuals. So who did you eat lunch with at the older levels is a pretty straightforward question. Who did you eat lunch with to a kindergartner is, undoubtedly a more challenging question. And so we rely on our teachers to give us better insight into things like seating charts for lunches. But we're really glad that we have this option to give more of kind of a reality-based experience to the contact tracing. So grateful for this lifeline, as Ms. Foster called it, of group exposure notices instead.
Thank you so much, Anna. And I like that the realities of sort of doing all of this is so poignant as we talk through all of this. Okay, I'm going to turn the podium over to Eric because I believe Eric has a question for Dr. Sutt.
I do, and it's not only the third grader that has trouble remembering who they had lunch with. I also struggle with that at this point in life. So, Dr. Sutt, CDPH recent guidance on group contact tracing recommends exposed students to test once weekly in the event of a wide scale and/or repeated exposure. What is the recommendation for metrics or a threshold that quantify wide scale and/or repeated exposure?
Yeah, thanks for the question, Eric. It's a good one. I think it kind of is very similar to some of the comments that Hannah had made too. Is when we were at the peak of the Omicron surge, there was, as she put it, a lot of noise. There were a lot of infections, not necessarily because of school. In fact, usually not because of school, but a lot of infections nonetheless. And so parents would be getting notifications, schools would be putting out notifications on such a frequent basis that it became a couple different ways of putting it. I guess not very informative. And so that's what was meant by widespread and repeated exposures. So too many exposures for a school to really feel like it would be helpful to continue to inform a parent and a community regarding it. So the language is kind of intentionally vague because it deals a little bit with school operations and school culture. And that's essentially what was meant. There wasn't intended to be a specific threshold. I've described this as a Goldilocks problem before. Is some families say like, we want to get notified every single time any single child in our school is exposed, and other families say just stop. We know going to school bears some risk, and we take our children to school acknowledging that, and so we don't want to know. And where you land in between all that is all a matter of where your school's culture and community are at in terms of the notification piece.
Thank you so much, Dr. Sutt, for explaining that and all of us feeling it. But it's good to also reiterate that we all are defining some of these things. Well, we have to, depending on our realities, our resources, and just sort of, the lived experience of us within our school system. So we don't have much time, but I really want to ask this question of our school experts. The question comes up quite a few times in conversations and meetings that we're in, and it's really around the students who decide not to test and sort of what does that mean then in reference to whether it's participation in other activities like sports, extracurricular, and also if you can, as I go around the room, if you could just talk about sort of what you do, some advice, just thinking through about those that are not testing and what we can help with other school administrators to sort of think about. Can I begin with you, Eric?
Yeah, absolutely. So, I think the further along we've come in the pandemic and the more testing that we've done, the more comfortable most people have become with testing. So we know early on, a lot of families didn't want to test. There was a lot of skepticism about the test kits and what's on the swabs and just something new. We all experienced that. And so really right now, we're not seeing a lot of families that are unwilling or unable to test. We do have those that they just don't want to participate for whatever the reason may be. And some of that can be fixed with really sitting down with that family, sitting down with that parent explaining to them what the process is, what it isn't, and what their implications are if they choose not to test. That is an option. And we tell our families, you absolutely can opt out of testing. However, it's going to impact you in your child missing out on their education, you potentially missing out on work. Here's what it is. If you want to be present for the first one, we understand that. So really making our families more comfortable is one of the avenues that we've taken. And then really just explaining to them what their options are and what they aren't. We know there's folks that like, I don't want to do any of it. I don't want to test and I don't want to keep my child home. I just want them to be in class. And we say, well, right now unfortunately, that's not one of our options that we have. So really just talking to them, I think all of us, the more we communicate with each other, the more ease we give to each other. Thank you.
Thank you. Very good. Thank you. Andrea, can I ask you? And then Hannah, if we have time, but I'll prompt you. I'd love you to answer as well.
I'll go quick. So I agree with Eric. I think it's twofold. One, I think parents need to be listened to. I think sometimes they just need somebody to fuss at and somebody to not fuss back at them. And then the other piece is options. When we first put testing into place, we had the same issues, test swabs, they have stuff on them, all of those concerns. And so we gave them options to do saliva, cheek, nose, as many options as we could give them. And then if they choose not to test, then that is an option as well to then stay out the additional time frame. And so again, listening and those options I think are vital.
No?
Yeah, it's a lot of +1 from us. It's really key to find out what the objection is and be able to meet people where they're at. I think what's been really helpful with our community is just to let them know that the trade-off is in their hands. And if they want to not participate in weekly surveillance testing, say for an athletic program, that is their choice, but they may not participate if they're not participating in the testing program. So being able to give them that choice and understand that there are consequences to every decision really helps once we get past all of the knowledge and fear side of things. I will say we're very fortunate that 95% of our student body is now registered to test with us. So that means that the majority have actually tested, and that just makes it that much more acceptable to say, hey, we're going to test and here's how we're going to do it. So really glad to see our community stepping up like that.
That's great. And I know we're coming to the end of the hour, but again, it sounds like communication, consistency, right? Just sort of all the themes that we've talked about. And I love that some people, people just need to fuss at someone, but the important part to remember is not fussing back, right? And just sort of helping, because we're all there, both as parents, as educators, as public health practitioners, and being able to do all of the work we do. So I will end today by thanking everybody for being here. I want to also just reiterate, Dr. Sud kind of touched upon that share repository that we have. It's on the school's website. We encourage all of you to go there. There's a lot of resources, but even more importantly, we encourage you to share. So if you can, really kind of putting what you're doing out there on group-based contact tracing strategies for improving ventilation in schools would be super helpful. We're all looking at sharing some of those best practices with the California schools, as well as our health leadership across the state. Please also note that all of our principal practices webinars are up on the Safe Schools for All website, especially the one last week, which I told you is under that Virtual Training Academy link, schools.covid19.ca.gov. Again, thank you so very much, all of you, for being here. Good luck with your programming, and we look forward to seeing you again soon. Have a wonderful evening.